Good evening, everyone. I'm audible. Dear friends, we are discussing, we are doing a detailing of TADI. What I'm thinking, we will do mixed class only, Hindi, English. That is okay. No separate class. That is okay. Repetition, the same thing after that. No meaning. So now we are doing detailing of TADI. TADI. T means tranquilizer point. Can you tell me the name of the tranquilizer point? Write in the chat box. Any three tranquilizer point. Any three. Write in the chat box. So three tranquilizer point will be actually Li4 is indirect tranquilizer point, not the direct tranquilizer point. If I ask you the very excellent tranquilizer point, then I will tell you Du20, Yin Tang, Hard 7, even pericardium 6. Okay. But other also we are studying, because whenever we are making the protocol, we are thinking for other also. तो हमारे जो सबसे बेहतरीन ट्रैंकुलाइजर पॉइंट है वो ये दो तीन है. Governing vessel 20, yin tang, heart 7, pericardium 6. Liver 3 is indirect, not the direct tranquilizer point. It's like it's even the Li4 is indirect. Now here I would like to discuss N-Mian. N-Mian. You might have heard about enemy. So this is the extra point or enmian. It is behind the ear. कान के पीछे होता है. And it is also very good for insomnia and disturbed sleep. The name of this point is anemia. हमारे कान के पीछे जाएंगे. If we are going on the back side of the ear, this is the extra part. Behind the ear, located on the back side of the ear, behind the ear. So I will tell you the location. So what is the location of enmian point? First, we should know the location of triple wormwood 17, which is exactly on the back side of the ear. हमारे कान के ठीक पीछे. ये खड्डा है, डिप्रेशन है. The depression and the point located here, that is triple wormwood 17. यहाँ पर हमारा जो बिंदु है वो कौन सा है? ट्रिपल वार्मर 70. So from the triple warmer 70, we have to go little back side and we will get the anemia. लेकिन एग्जैक्टली कहाँ जाना है, कितना जाना है? I will tell you. The anemia is located. I will show you the image here. This is a very famous acupuncture point located on the backside of the ear. So now look at this image here. इस इमेज को देखिए. So we can see in this image, this is a very good point for calming down the mind, insomnia, sleep, anxiety, vertigo. We can massage this point. It is very, very good for sleep. ये हमारे नींद के लिए भी बहुत अच्छा होता है. ये exactly कहाँ होता है ना? You can see in this. So Anmian is located behind the ear, कान के पीछे होता है. Okay. अब इसे ढूंढने का तरीका मैं आपको बताता हूं. If you know the location of gallbladder 20, we can find the depression here. That is the location of gallbladder 20. And this is the triple wormer 70. If you draw the line in between, the midpoint will be and इन दोनों के मध्य हमारा जो पॉइंट होगा वह होगा एनमिया. So this point located behind the ear, in between the master process and the gallbladder 20. तो पेशेंट को कैसे फील करना है? We have to ask the patient. हमें पेशेंट के ऊपर कैसे फील करना है? We have to move our finger. So first we feel this master process, then move our finger little backward, and we will feel depression. That is the gallbladder 20. Okay. In between we have anemia between triple wormer 17 and the gallbladder 20. This is the point little tender. ये point थोड़ा tender होता है. And if we do the massage here, this will bring very good sleep. It is very good for the disturbed sleep. It is very good for the anxiety and mental restlessness. So what we can do, we can put the yin tongue, we can put the heart 7, and we can put the Anmian. A wonderful combination to bring good sleep and for insomnia. नींद लाने के लिए ये एक बहुत ही बेहतरीन कॉम्बिनेशन है. ओके. आप इन एक एक पॉइंट की लोकेशन को आप समझेंगे हमारे इस कोर्स में. But right now, because we are discussing only the tranquilizer point, so now we have added one more point, that is Anmian. Okay. Even there is a further classification, Anmian 1, Anmian 2. But right now we have to stick with one point, that is Anmian. Both points are located behind the ear. दोनों ही कान के पीछे होते हैं. ओके. तो चलिए, ये हमारे ट्रैंक्विलाइजर पॉइंट की लिस्ट में एक पॉइंट और ऐड हो गया. Anmian, extra point. Okay. So if you ask me the very good tranquilizer point, I will highlight governing vessel 20. ये हमारा एक tranquilizer point है. So I am giving the red color. Yin Tang in the heart 7. Then Anmian. We can give the highest marks to these points because these points can be stimulated for all the condition of anxiety. जितने भी प्रकार की एंजाइटी की कंडीशन है हम सब में इन पॉइंट को ऐड कर सकते हैं. वेरी गुड पॉइंट कॉम्बिनेशन. देन पेरिकार्डियम 6 is very good point, also very good point for anxiety because it is a point having connection with the heart and chest, and liver 3 having connection with the irritability, anger and stressful condition. So now we are moving to the page number 2. Li4 we have discussed yesterday. Actually, Li4 is having one function that moving the chi very intensively. Li4 का एक काम है कि यह ऊर्जा को बहुत तीव्र गति से घुमाता है, मूव करता है. That's why it is more on the painkiller side, because the point who remove the blockage, that is the painkiller point. Okay, so I will be discussing this point again in the analgesic point of the painkiller point. Now coming to the gallbladder 20. Gallbladder 20 is one of the great point if you want to expel anything from head region. सिर का कोई भी कचरा फेंकना हो, gallbladder 20 is one of the very good point. So the gallbladder 20 is the point on the back side of the neck. It will clear the head, reduce the tension. And the gallbladder 20 is called the pool of wind. हम gallbladder 20 को विंड का स्विमिंग पूल बोलते हैं, विंड का तालाब, द पूल ऑफ विंड. It means if you puncture the gallbladder 20, if you massage the gallbladder 20, आप चाहे पंचर करिए या मसाज करिए, this will work very nicely. ये बहुत ही शानदार तरीके से काम करेगा. तो चलिए मैं आपको एक एक पॉइंट दिखा देता हूँ. So let's see the exact location of N-myan first. Then we'll be moving to the gallbladder 20. Is located. Let's see now. So right now we're talking about the N-myan. So this is the triple wormer 17 in the front side. This midpoint is N-myan. So N-myan point is located. हमारा जो N-myan point है वो कहाँ पर located है? If you look at in this image, in between gallbladder 20 and triple wormer 17, this is the point located called N-myan. Okay. Now let's move to the gallbladder 20. अब हम चलिए gallbladder 20 की बात करते हैं. So gallbladder 20 is point located on the back side of the depression. तो इसे हम कैसे locate करेंगे? Let's see. So gallbladder 20 is one of the very good point to expel the wind. So it's clearing the wind from head region. हमारे सिर में से विंड को क्लियर करने वाला एक बहुत ही महत्वपूर्ण पॉइंट है. So now we are looking. This is the location of gallbladder 20. We can feel the depression just below the skull bone. हमारी स्कल बोन के ठीक नीचे हम डिप्रेशन फील करते हैं. दिस इज the other name of this point is hang chi. Hang means bind and chi means reservoir. So the reservoir of bind. Bind is considered a major cause of head and neck disorders. हमारे हेड और नेक जो भी डिसऑर्डर्स होते हैं उनको बिंड्स के निकालने से बहुत फर्क पड़ता है. सो गॉलब्लैडर 20 इज द वेरी गुड पॉइंट टू क्लियर द हेड, to reduce the neck tension, improve circulation of the head, calming down the nervous system, and also expelling wind. Gallbladder 20, we are regularly using point for the headache, for the migraine, for the dizziness, for neck pain and all. So generally, we are using this point if the person is having excessive wind attack, which is creating problem in the head region, then we can put this point. हम इस point को लगा सकते हैं. क्या लोकेशन क्लियर है सभी? लोकेशन इज क्लियर. लोकेशन की बात हम फिर से भी करेंगे जब हमारा मेरिडियन का डिस्कशन होगा. But right now, I think in general location will be clear. So this was the discussion of gallbladder 20 or Fang Chi. Now we are talking about Ear Shenmen. Very good point. That is the Ear Shenmen. How many % doing the study of the auricular acupuncture? आप में से कितने लोग auricular acupuncture का अध्ययन करते हैं? They might be knowing Shenmen. Shenmen means, Shen means the divine light who is in the heart. So Shenman is the point who is available in the ear. We can see in this image. This is the ear. In the ear, we can see triangular fossa. कान के अंदर हमारा ये triangular fossa होता है. This is the triangular fossa. We have to go inside the triangular fossa. If we divide this triangular fossa in two parts, upper and lower, the Shenman is located in the upper part. If we divide the triangular fossa in three parts, 1, 2, and 3, Shenman located in the first part. So this is the Shenman. Shenman is also a very good tranquilizer point. And I will tell you, you can always put this point with the body acupuncture. You are doing the body acupuncture and you can put the Shenman point in the auricular acupuncture. Because I have worked with some persons who is working in US and they are working on mental problems, psychosomatic problem, hair problems. Whenever they start any treatment, they first put the DU20. Second point, they put yin tang. Third, this is optional. If the person is having sleep problem, then they put this point, otherwise no. Then they put the point heart 7, pericardium 6 in any one hand. Then after that, ear Shenmen in any one ear. In this way, they have created one protocol of few points. This protocol might be having 15 points. This protocol for working for all pain, each and every pain, whether the knee pain, back pain, neck pain, multiple pain. They start the treatment from here. 1, 2, 2 point here, 3, 4, ear Shenmen, then few more point in the body. Whatever the patient has problem, but they start from here only. तो पेशेंट को कोई भी प्रॉब्लम है, आजकल मुख्य रूप से थोड़ा बहुत तनाव तो रहता ही है, थोड़ा बहुत डिस्टरबेंस, यानी इतना मन शांत मन वाला व्यक्ति ढूंढ पाना बड़ा आज कठिन है ना. It's very difficult to get the person who is very living peaceful life, who is satisfied. Whatever is with me, I am satisfied. It is very difficult to find such person. So these points are working very nicely because these points are, yeah, definitely we can put only yin tongue. Whenever you are making protocol and if you find there are too many points, you choose any one tranquilizer point. Either you choose this or you choose this or you choose this, or you can put any one tranquilizer point because there are many more points coming soon. If you are putting the 6 points from the tranquilizer list, then what about the distal point? Then 6 points from the distal, it will become very big protocol. है ना? श्रीलंका में ऐसे प्रोटोकॉल लगाते हैं. श्रीलंका में एक एक पेशेंट को 60 70 निडल लगाते हैं श्रीलंका. They put not less than 50-60 needle. One patient came to me, doctor, you have put only 20 needle. I took the treatment in Sri Lanka, they were putting 80 needle to me. You are putting very less number of needle. Then I told for Indians 20 is also too much. Okay. So like they have their different working style, but that is also good. If the patient is getting benefit, whatever you are doing, it is good. Okay. So now, तो इस तरह से हमने देखा कि हमारा ये ट्रैंक्विलाइजर वाला मामला खत्म हो गया. तो हमने समझ लिया, ये हमने लिस्ट को कवर कर लिया. Here, Ear Shenmen, I will highlight, it is one of the great tranquilizer point. So whatever we have discussed till now, I will highlight few points. They are the very great tranquilizer point. Number 1, governing vessel 20, yin tang, Shenmen, then ear Shenmen. Here, first Shenmen is the heart 7. Second is the ear Shenmen. Then gallbladder 20. If the person is not having good sleep, you can add Enmian. Regarding these points are working in an indirect way, so we cannot tell them tranquilizer point directly, like the Li4, gallbladder 20, pericardium 6, liver 3, they are working indirectly. तो इन्हें हम डायरेक्ट ट्रैंक्विलाइजर पॉइंट नहीं कह सकते. चलिए इतने इसके साथ हमारा ट्रैंक्विलाइजर पॉइंट का जो डिस्कशन था वो भी एक स्टेप इसका खत्म हुआ. नाउ वी आर मूविंग टू द नेक्स्ट वन, दैट इज TA. A means analgesic point. So now we are going to discuss analgesic point, the great analgesic point or the painkiller point in the acupuncture as per traditional Chinese medicine. The great analgesic point is LI4, large intestine 4. if you are having pain anywhere in the body, whether the eye pain, tooth pain, any pain anywhere in the body, Li4 is one of the great analgesic point. Li4 हमारा सबसे बेहतरीन एनाल्जेसिक पॉइंट है. कोई भी पॉइंट एनाल्जेसिक पॉइंट का काम करेगा अगर उससे ऊर्जा का ब्लॉकेज निकल जाए. फॉर एग्जाम्पल, यू आर हैविंग लॉट्स ऑफ इमोशनल स्टैग्नेशन एंड आपके अंदर किसी प्रकार का बहुत इमोशनल स्टैग्नेशन है. नाउ यू आर गोइंग टू मीट समवन you are loving or he is loving you a lot, or you are going in the very natural atmosphere, you are going near the tree, you are going on the hill, you are going near the river. While seeing them, as soon as your blockage is going away, you feel the removal of the blockage, pain is also disappear. So pain can be disappear just by removing the blockage. पेन को हम सिर्फ ब्लॉकेज से निकाल सकते, ब्लॉकेज को रिमूव करके निकाल सकते, राइट. सो नाउ let's see the first point, that is very famous point, that is called large intestine 4, our favorite point. So we will look at once again the location of this point. So we can see the interosseous muscle here, and in between first and second metacarpal bone, near about in between or the top of this interosseous muscle, the top prominence of this interosseous muscle, हमारी से इंट्रोशियस मसल का जो पहली दूसरी मेटाकार्पल बोन के मध्य में है का जो टॉप प्रोमिनेंस होता है, यही Li4 है. ये Li4 है. इसे जब हम निडल लगाते हैं तो हमारा पेन चला जाता है और मसल पेन, बोन पेन, स्टैग्नेशन ठीक हो जाता है. दैट्स व्हाई Li4 इज कॉल्ड स्ट्रॉन्ग जनरल पेन किलर पॉइंट. Now, liver 3 is also releasing the pain which is stress induced. लिवर 3 भी पेन को दूर करता है, ऐसा दर्द जो स्ट्रेस इंड्यूस हो, क्योंकि लिवर 3 भी Li4 ही है एक तरह से देखा जाए तो, है कि नहीं. Li4 located in between first and second metacarpal bone. Liver 3 located in between first and second metatarsal bone in the feet. If you just imagine this is the feet, then this is the great toe, this is the first toe, in between भी है liver 3. उनके बीच में liver 3 है हमारा, है कि नहीं है. अंगूठे और पहली उंगली के मध्य में. So liver 3 also the wonderful painkiller point, but if this pain is having some connection with the stress, अगर इसका संबंध थोड़ा सा स्ट्रेस से है, like stress, headache, body pain, some person is having. Now there are two type of stress. Stress भी दो प्रकार का होता है. Number one stress, we are telling mental stress. Number two, physical stress. Mental stress, we know what is stress. Everyone know what is stress. Do you know what is stress? तनाव क्या होता है आप जानते हैं, है ना. कि जब तनाव होता है जब हम अपने आप को ओवर ऑक्यूपाई कर देते हैं, मतलब जब लगता है यार. स्ट्रेस भी नो, mental stress we know. What is the physical stress? Physical stress means someone is falling down, है ना. मैंने उदाहरण दिया था, मुझे उस दिन फील हुआ कि फिजिकल स्ट्रेस क्या होता है. आई वॉज ड्राइविंग माई कार एंड माई व्हील गॉन इन वन खड्डा. मची गॉट स्टैग्नेंट इमीडिएटली. जैसे मेरी कार का पहिया एक खड्डे में चला गया और कार उठ गई एक तरफ से, 30 डिग्री inclinement from one side. Immediately I felt, oh, what is the chi stagnation? One person is falling down from a scooty. Suddenly, oh, she got stagnant. We are getting some trauma in our life. It might be physical trauma. कोई बीमारी हो गई, डॉक्टर के पास गए, डॉक्टर ने बोला भैया तुमको कैंसर हो गया, भैया तुमको लग रहा है कैंसर के चांसेस हैं. This is stress. It will do that. That's why when the person is coming to you and we are telling, don't worry, you don't have any problem. This is the first treatment. आपकी जो प्रॉब्लम है इतनी बड़ी नहीं है. बट प्रैक्टिकली आई विल टेल यू कि वी हैव टू लिटिल क्लियर ऑल्सो इन अवर क्लिनिक, अदरवाइज वो हमें कभी कभी गले की हड्डी भी बन जाता है पेशेंट. अगर आपने पेशेंट को बोल दिया कैंसर है उसको या बड़ी प्रॉब्लम है, किडनी फेलर है, इफ द पर्सन इज हैविंग वेरी बिग प्रॉब्लम and you're telling you don't worry, you don't have much big problem, then patient will ask you after 3 days or after 1 week, oh 1 week is over but my problem is not cured. Sometimes it is also necessary to tell the patient that your problem can be treated but it's not so ordinary, it need great effort, and after putting the great effort we will be able to treat it 60-70%. But don't worry, even the 60-70% will give you very comfortable and peaceful life. In this way we have to answer. हमें आंसर देना चाहिए, क्योंकि अगर आपने हर, लेकिन फिर भी वी हैव टू गिव सम वेरी पॉजिटिव वर्ड टू द पेशेंट, otherwise it will also create chi stagnation and person will get some pain. So Li4 is one of the very good point that is called strong painkiller point. Liver 3 is also painkiller point, which is stress induced. So that's why Li4 and the liver 3 combination we can put for many patients for all the pain, because this is the very powerful combination and called 4-gate. Li4 और liver 3 का जो combination है ये full body pain के लिए बहुत ही बेहतरीन. Now one more painkiller point I will tell you, that is stomach 44. So let's go and see the another point. अब हम दूसरा पॉइंट देख रहे हैं. ये हमारा stomach 44. It is also wonderful painkiller point. So we can see in this image here between the second and third toe, from the bib margin if you go half chun, अगर बेब मार्जिन से थोड़ा आधा चुन proximal चले जाते हैं. So from the bib margin just we are going half chun, that is the stomach 44. Stomach 44 is very good painkiller point, and especially this point is working for face and stomach. Face and stomach. Face means toothache, mouth pain, facial problem, any facial pain and gastric problem. तो स्टमक 44 भी हमारा बहुत ही शानदार पेन किलर पॉइंट है, और स्टमक 44 को हम लगाकर भी ये सारा काम कर सकते हैं. बट आई हैव नोटिस्ड, मैंने एक चीज नोटिस की है, stomach 44 if we are using too much it might create weakness in the patient body. Suppose patient you are giving 2 treatment in a week, no problem at all. If the patient is having lots of stomach heat, no problem at all, you can give more treatment. But if you are using in general stomach 44 using too much, like you are using every day and you are using for long time, okay, you can use it if the patient is strong, having good amount of the chi. If the patient is weak, old, then please don't overuse stomach 44. स्टमक 44 को अगर हम ओल्ड पर्सन्स के लिए, जो कमजोर लोगों के लिए अगर ज्यादा प्रयोग करते हैं, तो यह हमारे शरीर में कमजोरी और वीकनेस को जन्म दे सकता है. गॉट इट? So this is also one of the very good painkiller point. Now next painkiller point I will tell you, please remember I am telling you one of the great painkiller point once again, that is called Tai Yang. From the corner of eyes, this is the corner of eye, if I go near out one chin back, I will feel the depression here. अगर हम जहां पर हमारी आईब्रो खत्म होती है, आईब्रो एंडिंग फ्रॉम देयर, इफ यू आर गोइंग वन chin back, that is the location of depression. We can feel the depression here, and you have realized when the person is having headache, this point is very painful. This point is the entry gate of lots of problem of the brain, because from here we can treat multiple structure of the brain. We can feel the bony डिप्रेशन, यहां पर हमें एक हल्का सा डिप्रेशन महसूस होता है. ये पॉइंट बहुत गजब का है. ये पॉइंट गजब का क्यों है मैं अभी बताऊंगा, लेकिन पहले मैं आपको इसके बारे में इसकी थोड़ी सी लोकेशन बता देता हूं एक बार. देन विल सी दिस पॉइंट वंस अगेन. So let's see this point here. We are talking about ताई यांग. हम किसकी बात कर रहे हैं? ताई यांग की बात. So now we can see in this image here. So from the lateral corner of the eyebrow, we have to go little away. So let's see this point. ताइयांग हमारे एक वो बिंदु है, एक ऐसा पॉइंट है ताइयांग. इट इज द जंक्शन पॉइंट ऑफ फ्रंटल बोन. ये हमारी फ्रंटल बोन का जाइगोमेटिक बोन, टेम्पोरल बोन, parietal bone. This is the junction of the all bones. So parietal, temporal, frontal, zygomatic junction. And inside there is a one more bone that is called sphenoid bone. So what I want to tell you, Taiyang is the great junction of very too many bones. We can see in this image. So this is the location of Taiyang from the eyebrow. So we are going at the level of eyebrow 1 inch or the 1 chin back. This is the location of this point. ये हमारे इस point की location. So Taiyang is the great painkiller point or the analgesic point for working for headache. ये हमारे headache पर काम करता है. So whenever you are thinking for analgesic point, you first think for LI4. Second, you think for stomach 44. And third, you can think for ताइयांग. आप ताइयांग के बारे में प्लान कर सकते हैं, सोच सकते हैं. And whenever patient is required this point, you can add this point. Now, next painkiller point, they are called Ahasi point. Ahasi point means we are pressing and we are finding the pain. So, okay, so we have discussed LI4, stomach 44, Taiyang and Ahasipa. Enough. So, what we have discussed till now, अभी तक हमने क्या समझा है? In the TADI, TADI, we have discussed about the T. T means tranquilizer, we have completed. Then A means analgesic. So suppose some patient is coming to you, and you are making the protocol. How you will make the protocol? Okay, DU20, yin tang, heart 7, pericardium 6, and maybe you are using LI4. Okay. If the patient is having a headache, you can use Taiyang. If the person is having stress, you can use Taiyang. If the person is having tooth pain or the facial pain or the gastric problem, you can use stomach 44. Till now, we have discussed this much, and I will tell you this much treatment also very good. If the person is having a stressful condition, you can add liver 3. I hope till now everyone is clear. अब इसके बाद में आपको एक ग्रुप में भी मैं एक बहुत ही शानदार मैं आपको पीडीएफ दूंगा. तो ताड़ी में तीसरे नंबर पर क्या आता है? टी हो गया, ए हो गया, डी. डी मीन्स डिस्टल पार्ट. So first I will tell you only 1, 2, 3, 4, 5, 6. First I will tell you the very important 6 distal point. पहले मैं आपको सिर्फ 6 डिस्टल पॉइंट की बताऊंगा. 6 डिस्टल पॉइंट के बारे में. They are the most important distal point. But distal point, first we have to understand what is distal point, because now our discussion is moving toward distal point. So what is distal point? Let's see here. TADI, TADI, T means tranquilizer is over, A means analgesic is over, which is painkiller. Now D means a distal point. So the distal point means the point treating from distance, ऐसे बिंदु जो दूर से ट्रीटमेंट करते हैं. जैसे उदाहरण के लिए मुझे यहाँ कोई पेन हो रहा है और मैंने फोन किया किसी को, मैंने रितु जी को फोन किया, रितु जी ने अपने घर में बैठ के ठीक कर दिया. इसे कहते हैं डिस्टल ट्रीट. डिस्टल ट्रीट. Okay. Fine. So in this way, the distal point means who are away, but they can treat. In the human body, I'm having headache. I will go away somewhere in the fingers, or I will go away somewhere in the feet, and I will able to treat the distal. I will able to treat the disease. इसके लिए मैं एक बहुत अच्छा उदाहरण मैं पहले दिया करता था, एक बार इसे रिपीट कर देता हूं. एक गांव में एक वैद्य जी रहते हैं जिनका घर गांव के बाहर बना हुआ है, जहां उन्होंने एक जड़ी बूटियों का गार्डन उगाया है. कोई भी बीमार होगा तो वैद्य जी के पास जाएगा और वैद्य जी वहां से जड़ी बूटी उसको दे देंगे, घोंट के पिला देंगे, वो ठीक हो जाएगा. तो वैद्य कहाँ बैठे? गांव के बाहर बैठे. सो द पर्सन हु इज सिटिंग आउटसाइड द विलेज, so this is the example, a person who is living outside the village, a vaidya or doctor who is treating entire village with the help of different herbs. If any person from the village is getting ill, getting some disease, getting some pain, going to the doctor or Vedraji, that Vedji will give some medicine, some herbs, some Ayurveda jadi buti, and person will become okay. So it is called distal, means someone who is not in the place but outside the place and but attached to the place only. That is distal point. So distal point means they are away from the painful area but still help to treat the problem. Distal point वो बिंदु होते हैं जो पेनफुल एरिया से दूर होते हैं फिर भी प्रॉब्लम को ठीक करते हैं. फॉर एग्जांपल, you are having headache, we are treating in the hand. Some person is suffering with the back pain, we are treating the feet. Person is having stomach problem, acidity, indigestion, we are treating with the feet or the leg. So distal point might be anywhere. I will give an example. So first I will tell you the 6 distal point. then I will tell you a big list. तो पहले हमारा लक्ष्य है कि हम 6 डिजिटल पॉइंट का डिस्कशन करते हैं, बिग लिस्ट का डिस्कशन हम अगली क्लास में करेंगे। चलिए, सो लेट्स स्टार्ट। सो दिस इज द ह्यूमन बॉडी, ये हमारा शरीर है। Okay, if the person is having any problem in the head and throat, LI4 is the distal point of this area, LI4. If the person is having any problem in the head, like migraine headache, the pain of the eye, the facial pain, tooth pain, facial paralysis, brain disorders, throat infection, thyroid problem, hypothyroidism, hyperthyroidism, any problem of the head and throat, we will be treating with the help of LI4. LI4 is the distal point of this part. And we know LI4 is located in the hand. So away from this region, LI4 हमारे hand में होता है. The second distal point is in the chest cavity, that is pericardium 6. Pericardium 6 is working on any problem of the chest, whether the problem of the lungs or the heart or the chest muscles or the whatever the problem happening in the chest, pericardium 6 will be distal point. Pericardium 6 हमारा छाती का distal point है. It is the very good point for any problem of the chest cavity. Now we are coming in the abdomen. So the distal point of the abdomen will be stomach 36. Any problem of the abdomen. Now it is not only stomach, whether the person is having problem with the liver or the gallbladder or the stomach or the spleen or the pancreas or any part who is coming in the abdomen, or we tell upper abdomen. Even the person is having problem with the stomach, acidity, indigestion. Stomach 36 will be the distal point of this part. Stomach 36 सभी प्रकार के गैस्ट्रिक इशू को ठीक करेगा, लिवर के इशू, गॉल ब्लैडर का इशू, पैंक्रियाज का इशू, जो भी इस पार्ट में है सबको ठीक करेगा. नाउ वी आर कमिंग टू द लोअर एब्डोमेन और द जेनिटल पार्ट. The distal point of this part will be spleen 6. Any problem is like person is suffering with the intestine problem, constipation, we will treat spleens, we will birth with the help of spleen 6. If the female or suffering with the menstrual problem, gynec problem, spleen 6 one of the very good distal point for all type of the female disorders like polycystic ovary, painful menstruation, dysmenorrhea, period problem. पीरियड की किसी भी प्रकार की प्रॉब्लम के लिए स्प्लीन 6 बेहतरीन पॉइंट है. स्प्लीन 6 इज वेरी गुड पॉइंट फॉर मेल फीमेल रिप्रोडक्टिव प्रॉब्लम, constipation, any problem which is happening in the lower abdomen or pelvis. So these 4 distal points just now we have discussed for the front part of the body: LI4, pericardium 6, stomach 36 and spleen 6. Now 2 more distal point will be discussed on the back side of the body. अब हम शरीर के पीछे की ओर 2 distal point और सीखेंगे. Now I am making the back side of the body. This is the back side. Anyone is suffering with any problem from back side of the head, back side of the neck, and back side of the upper back till the diaphragm. Any problem in the back side till the diaphragm, one point that is lung 7, which is called distal point of this part. Lung 7. अब किसी ने कहा कि इसे हेडेक हो रहा है, posterior headache, lung 7, cervical spondylosis, lung 7, upper back pain, lung 7. Now, if you make the protocol, for the neck pain, and if you include the lung 7, this will become very effective protocol. ये आपका बहुत ही शानदार प्रोटोकॉल बन जाएगा. गॉट इट. एक बात ध्यान रखिएगा, हम प्रोटोकॉल फॉर्मेशन सीख रहे हैं. प्रोटोकॉल फॉर्मेशन में मैंने क्या बोला, प्रोटोकॉल का निर्माण कैसे होगा, ताड़ी प्लस स्ट्रीम लुमुसु एंड सॉक्सी. मैंने ऐसा नहीं बोला कि प्रोटोकॉल का फॉर्मेशन सिर्फ डी से हो जाएगा, ऐसा बोला मैंने? बोला. If you want to treat the gynecological problems, if you want to treat the uterine fibroid, only spleen 6 will work alone? No. You have to make the protocol. That's why we are discussing this entire sutra. Tadi plus stream, Lumisu and Soxy. Spleen 6 is one of the very good point for uterine fibroid, for polycystic ovary, but single is not enough. You have to at least take the 4 or 5 point or the 6, 7 point. Yeah? Okay, fine. So now, lung 7 is the point which is working for occipital headache, सिर के पीछे का दर्द, neck pain, neck spondylosis, upper back pain. Now, any problem below the diaphragm, the point will be urinary bladder 40, below the diaphragm. हमारा जो लंग 7 कहाँ होता है, ये भी 40 कहाँ होता है, इसको हम देख लेते हैं एक बार. Lung 7 and UB40. UB40 is one of the great point for lower back pain. हमारा यूरिनरी ब्लैडर 40 एक बहुत ही शानदार पॉइंट है लोअर बैक पेन के लिए. तो चलिए पहले मैं आपको लंग 7 बताता. You can see this depression here. This depression is called anatomical snub box or large intestine 5. From this depression, if I keep 2 finger, I will reach on lung 7. अगर मैं ठीक इसी डिप्रेशन की लाइन को फॉलो करता हुआ 2 फिंगर नीचे आ जाऊं, प्रॉक्सिमल आ जाऊं, 1.5 चुन प्रॉक्सिमल, that will be the location of lung 7. So let's see here. You can see this is the lung shape. Visible? Lung 7. We can put the needle horizontally, whether moving, directing upward, because here you will feel bone. यहाँ पर आपको हड्डी महसूस होगी. You will feel the bone. So when you want to put the needle, you can put the needle like this. See, you can put the needle like this or like this. ऐसे लगा दो या ऐसे लगा दो. This is the lung channel. Actually, lung meridian is like this. Lung meridian is going like this. But here lung meridian turning up and going from off the track. And this is the lung 7. Then lung meridian coming back. तो लंग मेरिडियन सीधा चलता है, लेकिन यहां पर थोड़ा ऊपर चला जाता है और फिर नीचे आ जाता है. So lung 7 is on the bone. In the line of Li5, हमारा ये होता है लंग 11. ये जो लंग 11 जो ऊपर जाता है और फिर नीचे आता है, इसी के कारण इस पॉइंट का दूसरा नाम है ब्रोकन सीक्वेंस पॉइंट. The other name of this point is called broken sequence of the leak of the road. इसने अपने मेरिडियन को ब्रेक कर दिया ना, मेरिडियन को ब्रेक कर दिया और ऊपर चला गया, फिर वापस आ गया. That's why this is called the point. The other name of this point is broken sequence of the meridian. Very good point for. Now I am telling you, if you make the protocol by this concept, in first sitting itself, you will see, oh, I'm feeling much better in my neck pain. My shoulder pain disappear. Okay. This occipital headache gone, upper thoracic pain is gone. Lung 7 is the point. Now, we can see here also. Let's see now. So now in this image, we can see the bone. This is again, we are showing the location of the lung 7 from the anatomical snap box. We have to go 1.5 chun proximal. हमें 1.5 chun proximal जाना होगा. This is the point. 2 finger proximal or the 1.5 chun proximal. Got it? We can put the needle. When we put the needle, we can squeeze the skin. So we will able to put the needle very easily. हम इस पर needle आराम से लगा सकते हैं. So this is the very good point, the distal point for occipital headache, neck pain, upper back pain till the diaphragm. Now, bladder 40, urinary bladder 40. This is the point located on the backside of the knee. हमारा जो bladder 40 होता है, bladder 40 is very good point for lower back pain. We can see here, this is the backside of the knee, the midpoint of popliteal crease. हमारे जो popliteal crease का midpoint है, वही है bladder 40. We can see here in this image. This is the bladder 40. We can put the needle here, we can do the blood cupping here, we bleeding here, hezama here, or we can just put the needle or we can put in the sujok. This is the distal point for lower back pain. तो हमने कितने distal points सीखे? 6. Please write on the chat box immediately or in the group. And if you have read right, you even click the photo and put in the group immediately 6 distal points. कौन सा 6 distal point लिखिए immediately. So this is the chart of the distal point. Now I will show you the big chart. This is the big chart of the distal point. See. In the next class, we will be discussing the all distal point, because once you learn the distal point, how many? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 distal point. If you learn all the distal point, you can do one treatment that is called DNA, distal needle acupuncture. Because distal points are very much effective. Sometimes single point you put the magnet or needle and it will bring effect. तो ये सब की हम बात करें. तो आज हमने 6 की बात की है, जो 6 सबसे महत्वपूर्ण है. पहले हमने इनकी बात इसलिए की है कि कम इनको ना भूल जाओ आप ज्यादा के चक्कर में, है ना. कभी कभी क्या होता है कि ज्यादा पढ़ते हैं तो पूरा ही भूल जाते हैं. So what we have to do, we have to remember these 6 distal point. If you want to forget other, then you can forget some point, but do not forget these 6. Because these 6 are very important. ये 6 बहुत महत्वपूर्ण है. So enough for today. Now we'll do our class on next Monday. अब अगले मंडे को अपनी क्लास करें. ठीक है. Thank you so much. Closing the session.